With a background as a licensed social worker specializing in addiction services and harm reduction, Melissa is the first licensed social worker to serve on Columbus City Council. Today on City Chat, join us as we sit down with Councilmember Melissa Green to learn more about her and the initiatives she plans to focus on during her time on council. Councilmember, thank you so much for coming on to City Chat today.
Thank you so much for having me.
Before we get started, could you tell us a little bit about yourself, kind of cover your professional, impressive background, and then perhaps something personal too?
Yeah, so thanks again for having me on the show. My name is Melissa. I am a very proud licensed social worker, and throughout my career have pretty much worked at every level of our human services sector, both in direct practice as a child and family therapist in a clinician's role, also in public health and state level policy and advocacy work, and in nonprofit leadership. And so very excited to bring that perspective to the table for the first time here at Columbus City Council. I currently live on the Hilltop with my partner Mike, who is an environmental entrepreneur and small business owner here in Columbus. And then also our 3-year-old son Miles, who are both 4th and 5th generation Hilltop residents, which is really fun for me. I've spent the better part of the last decade doing community advocacy work on Columbus's west side. So now to represent Columbus from District 6, which includes the Hilltop, an area that our family has such a deep connection to for so many generations, it's really exciting.
Yeah, that's a perfect fit,
Yeah.
And we're lucky to have you on council. You were talking about your background in addiction services and harm reduction, and your experience with families and counseling. Can you let us know where that passion came from?
The perspective that I bring with me from the work that I did in harm reduction in the addiction space informs absolutely everything that I do. At the point when I moved into a harm reduction advocacy role, it was right as this wave of the opiate crisis was really starting to peak in significant ways for the first time here locally. And it was also a time, I think, not just in Columbus, but across society, where we still had a lot of deeply rooted biases and misconceptions about, addiction as a chronic relapsing brain disease, about, criminalizing people who are living with this life-threatening disease, about harm reduction as a set of best practices, right, which are rooted in the idea of keeping people as alive and as healthy as possible and as connected as possible, so that we can help them move forward in their recovery journey. But a lot of misconceptions in our community about harm reduction potentially enabling substance use. And so it was the very first time in very real and direct ways that I had ever really seen firsthand how intrinsically linked my ability as a social worker to help uplift and empower people in our community, especially those that are experiencing hardship, how my ability as a social worker to do that was so linked to policy and to politics.
Yeah.
And so, if I kind of trace back that trajectory, I certainly didn't become a social worker because I thought it would be my one-way ticket to an elected office. But I think, the earliest embers of, kind of a commitment to activism in this policy space definitely started there.
What would you say is the biggest misconception about addiction?
I think that across the board there's a lot of shame and blame assigned to people who are living with addiction. People that are living with addiction are not unlike you or I, but in any way, shape, or form. Addiction is a chronic relapsing brain disease, and there are a lot of complex biological and social factors and circumstances that contribute to someone developing a substance use disorder. And so recognizing the medical aspect of this and the best practice interventions and long-term treatment. It's not unlike if you fall down the stairs and break a leg, for example, you have to have an immediate intervention. You need long-term physical therapy and support. You're going to be dealing with that that catastrophic injury for the rest of your life in a lot of cases. And so addiction is kind of the same way. Recovery is a journey. It's not linear. It's cyclical, and so helping people understand that is really, really important.
That's amazing. Thank you for that perspective. You now chair of the Health, Human Services, and Equity Committee. You did touch a little bit on this. How do you, in the future, how do you plan on using what your career background is and applying it to the future of Columbus?
So it's an exciting time, I think, in general, to be a social worker. We're very in demand. I think in some ways it feels sometimes like social work is just this kind of one-size-fits-all solution to a lot of these really, really big and complex challenges. Addiction, poverty, mental health care support, now here in Columbus, police reform. And so, when you imagine that, when you imagine the totality of the positive impact that social workers are having on the field, and then compare that to historically the knowledge that these decisions have been being made, and we're responding to these issues, but we're not always represented at the decision-making table to help guide the decision-making and the investment in those processes. Nor are, oftentimes I think the voices of the people in our community that are most impacted by these issues and the people with lived experiences. And so I think that's one thing that I really carry with me from harm reduction. We have this mantra, nothing about us without us. And so I think, kind of bringing forward this perspective and pulling up a seat at the table and making sure to bring others for our friends in the community and across the field is going to be really important in helping us build our human infrastructure.
When you guys are, making these decisions like on council, there's just so much like intricate planning that you guys have to do and like have to think out everything from your perspective and what your office does. Like, how do you determine the priority of like what comes first, of what needs to be addressed when it comes to like these issues like police reform or like mental health or like mental health of mothers?
Definitely need some support. Well, I think that's a process that we need to engage in now. I think that, and this is not a Columbus problem. This is an everywhere in society problem. Historically, as far back as like the Great New Deal, the biggest legislation package to ever be passed to support our people in our community. We haven't always done a great job of taking care of each other, especially the people across our society that are experiencing hardship. And so, you'll hear people all the way up to Governor DeWine has said, our systems of support aren't broken. They're just systems that were never built. And so we have sort of a patchwork of programs and that we have developed in response to challenges. And so I think what I would propose the time is now is for us to be proactive in acknowledging the data that we have before us, the increases in need across our community post-COVID, especially now, and figuring out how to stack hands with our partners around the community, with our partners in other local governments, to really engage in this work in a meaningful and strategic way together collaboratively, so that we're not kind of reframing the challenges of the past. The good news is, though, I think, across our field, across the human services sector, even though we are one of the lowest paid workforces in the entire United States, we are also one of the most highly educated. Most social workers have master's degrees. And so, we have the tools and we have the knowledge and we have the expertise to be able to address the challenges that we have both now and also ahead of us in the future. We just need the investment in developing those systems.
Last question, what do you hope to achieve during your time on council? And if there was just like one message that you could tell everyone, what would that message be?
Well, again, I think adding into the dialogue, the work that we have ahead of us to build that human infrastructure is really important. Helping people understand the importance of these investments. I think a lot of times, when we're not necessarily here in Columbus. I think in Columbus we have leaders that are incredibly compassionate and understanding. But historically, across government funding in general, it's been seen more, these investments have been seen more like charity or philanthropy or, something that isn't kind of a carve out in a budget that's absolutely necessary and integral to the functioning of our society. And so I think figuring out how to, help bring people into that conversation with us about the absolute necessity of investments in this human infrastructure is probably my number one goal. And I think that if I had one message to leave with everybody, I think it's just that we all have a part to play in doing this work and taking care of each other and loving each other. I think as a society, a lot of ways we have gotten away from that. We've gotten away. We focus a lot more on the things that make us different from each other, the things that divide us, and not the things that make us human and united, and that we all have in common. I think in more cases than not, no matter what side of the aisle you're on, we all share the same kind of end goal in mind. We all want to see welfare and well-being, hopefully, and most people, I will say, desire to see, a prosperous, thriving community and welfare of everybody. We just have a different roadmap or a blueprint for how we think we need to get there. And so I think I hope, I see myself as a piece of this work, as a partner to this work, but it's going to take all of us who are united in that end goal to work together to not just listen to our differences, but try to understand our differences so we can figure out how to make it where we must make it, which is an equitable community here in Columbus. So,
thank you, council members, so much. It was really great to have this conversation with you, and I'm really grateful for all of the work that you're doing.
Thank you. Thank you for having me.
I'm Josie Smith. Thanks for watching City Chat on CTV.